Ciao mondo, hello world, hola mundo, hello monde, konnichiwa, ni hao, namaste. We're here in San Diego today with two friends, Javier, Neyra, and Oleksa Rewa, and they are organizing the 35 session of ADQI meeting. This special ADQI meeting has a title, and I don't want to spoil anything because I want them to tell you what it is about. So, Javier.
Well, we want to promote really implementation science applications in the field of acute kidney injury. We have bring a great group of scientists, including implementation scientists, clinicians, and representation from the field. So we're very excited really with the conclusions and statements from this ADQI, and we want you to stay tuned for the recommendations that are going to come after this.
So before the recommendation, I think we have questions, right? So what are the main questions related to implementation science in AKI?
I think the main question that we're looking to answer is, why haven't we implemented the best practices that we have good evidence to support in the field of AKI care? And together with the group of experts that we've brought together, we've had so far a good day and a half of excellent discussion, some debates, and are now getting towards our consensus statements that we'll be presenting in a very short time.
So just to make clear, implementation science is not about implementing only high level of evidence procedure or therapies, but simply is a methodology that can be applied to any type of procedure or decision process that is made in one center, including center with limited resources. So it is much more to let people know how the so-called logical model of implementation science can work. So can you quickly comment on this concept of logical model?
Absolutely. So it's framing the problem, right? So what problem we have in front of us in the AKI care of patients, that we can use all these tools to try to accelerate best practices that can reach the patient and also can improve our healthcare systems. So this all logic, it's something that we can use, as Claudio said, in different resource settings to really try to bring the best therapies to our patients at the right time.
In practice, we have elements that can facilitate implementation or that can be represented barriers to implementation, right? What are these facilitators and barriers things?
Absolutely. So a couple of barriers that we've identified at a very high level is the fact that in acute kidney injury, there are many different stakeholders that we have to consider, be it intensivists, nephrologists, nurses, policymakers, and that's why we brought that group together here to now turn those barriers into launch points for facilitators in order to ensure that we can implement our best practices as quickly and as effectively as possible.
Yeah, so at the end of the story, you know, in spite we have even well accepted guidelines, for example, there is evidence that show that only 25–30% of the cases fully implement those guidelines. So I think there is a need to translate knowledge into things done. And I think this is the main scope of this ADQI meeting. So let's stay tuned because the manuscript will be fantastic with questions and statements, and probably we will move forward the field as we have done in the 35 editions of ADQI since 2000 in New York. There was a first meeting on CRRT. With this, thank you very much for joining today Cappuccino in San Diego, and have a wonderful day. Excellent.
Really good.
Excellent.